I like the moving, moving. I like the moving, moving. I like the moving, moving. We like the moving.
We'll be discussing the hypoglossal nerve, cranial nerve number 12. The name comes from the ancient Greek meaning under the tongue. The hypoglossal nerve is located closest to the posterior of the head compared to all the other nerves. The hypoglossal nerve pathway begins near the midline of the medulla oblongata in the hypoglossal nuclei of the brainstem. After exiting the medulla, its several sections combine to form two roots at the base of the skull. The roots travel through the hypoglossal canal where they connect and go down to the posterior of the neck. Before long, the nerves curve slightly superior and end on the underside of the tongue. The hypoglossal nerve innervates all muscles of the tongue, excluding the palatoglossus muscle, which is innervated by the vagus nerve. These muscles control tongue movement needed for speaking, chewing, and swallowing.
Testing the hypoglossal motor nerve, cranial nerve number 12. The therapist has 3 tests that they can perform on their patient to test this nerve. The first test, the therapist would ask the patient to press their tongue as strongly as they can to the sides of their mouth and with their fingers feel the strength of the tongue. Damage to this nerve would cause the tongue to atrophy and it would lose strength. The second test, the therapist would have the patient stick their tongue straight out. They would check for deviations and a slant to the affected side. Fasciculations would also be present if there was nerve damage. The ability to move the tongue from side to side indicates a healthy hypoglossal nerve. The third test that a therapist could use to test the hypoglossal nerve is have their patient say la ta.
La, ta.
These are complicated sounds that require fine motor control, and damage to this nerve would inhibit correct pronunciation.
Possible injuries to the hypoglossal nerve include tumor, stroke, and infection. These would disrupt the normal function of the hypoglossal nerve.
I like the moving, moving. I like the moving.